first consultation with the first consultant I met at the interview, before I went into hospital, although I went in within 2 or 3 days, was that I got one option. There was no choice, it was simply urethral catheter. I was unhappy about that, really. I wondered if, what's the problem, why can't I have something else? What are the choices? There were, I hadn't done my Googling, and so I wasn't aware of various choices, which I wish I had.
You have to sort of ask around about the products, and I think that's one of the things on the urinary, the indwelling catheters that I've found. You're not offered any choice, and there are apparently choices out there, and I think, although they hadn't anticipated for me that I was going to have them for 4 months, having some sort of dialogue on what you like wearing and what might be the most suitable product for you would be good. And because I've only had a urethral catheter as well, I think knowing that I've had them for periods of time, maybe the other sort, the suprapubic, might have worked better, but then it's difficult to know when they didn't really know how long I'd be left with the catheter.
Well, I went through all sorts of funny palpitations and odd feelings of losing consciousness or going in and out of consciousness. But I did have the strength to try to contest this, transferring from a urethral catheter to a suprapubic catheter, as it was called. And the consultant said, oh no, it's standard procedure here. If you have your urethral catheter for too long, it's liable to infection. So we actually insert this new catheter into your bladder under local anesthetic, or some modified form of local anesthetic. And a date was arranged for this, and then I was transferred to the table.
Did you say that you tried to argue against having one?
Yes, because I didn't like the thought of somebody planting something in my bladder forever, because I anticipated the discomfort and the problems it might cause.
I went for initially a urethral catheter permanently, and that was all right, but it wasn't what I wanted to stay with, because urethral catheters are all well and good. However, being a male, to even have something simple as sex, you couldn't easily do so with that catheter in situ. So I made an appointment to see my urologist consultant again at the hospital. I said, okay, I can do this through suprapubic method instead. That way, if I want to have sex, I can easily, without having to try and tie something back. So that was no problems.
For me, the suprapubic is much easier, more functional, allows me to take responsibility. I also think I would find a urethral catheter very sore, and I couldn't go horse riding or anything like that. This enables me still to horse ride, to go on an exercise bike, that kind of thing, that I couldn't do urethral because around the urethral area I still have a little bit of sensation, and I think I would find it very sore.
So that's a big advantage.
It's a big advantage, yes. The suprapubic, you don't get any pain from a suprapubic. You can keep it clean. You can see whether it's functioning or not. I can see the colour of my urine. I can see if there's sediment in it. I can smell it. I can sort of. It gives you control back in a situation where, God knows, we all feel we're completely out of control.
In in general, your interaction with health professionals, how's that been over the years?
It's fine. I mean, I what health professionals have done for me is mammoth. I've been helped enormously by some tremendous people. Great kindness, and the nurses in the spinal unit, I remember being incredibly proactive about. They were really good at helping me manage all the different bladder options, and they were better than consultants, to be honest. They were much. Again, it's that whole thing about, I think, bladders and catheters being devolved to nurses. I think nurses know a lot more about it than the consultants, the actual practicalities of it. Maybe that's something that has to be changed if we want to develop a new catheter. But I can't fault the hands-on care I've had from the nursing staff in particular.
I probably get deliveries once a month of leg bags, night bags, all the other bits and pieces as well. You know, they also supply wipes. They also supply disposal bags because every day there's a dead night bag, right? And they go into a plastic bag which we can actually get rid of in the rubbish, right? So yeah, they're very useful, and they have actually been quite helpful.
And can people get all that information from the hospital when you first go there?
Unfortunately not. The hospital information is one of the problems, I think, is that the hospital information is lacking in the sense that they believe that this sort of care, this sort of ongoing information, should be the province of the GP, right? And that doesn't. The hospital will deal with acute situations, but not ongoing situations.
Well, I did find that the actual support side on catheters was quite limited, that when you go home, I never had district nurse support. Not that I felt I needed it, but there would have been times, for example, I got an infection one time and had to go back to the hospital, which was an hour's drive away. There were times when it would have been useful to have had some additional support like that, so someone to call. But then I didn't need someone every day to sort of help me change the bags or look after them. It was actually quite straightforward.
Yesterday they suddenly realised that there had been a blister. They didn't mention it when they were cleaning me in the morning, and I can't see it. I can't see when they're cleaning me what goes on down there. They said, well, there's a hole formed. The blister has burst and there's a cavity formed around the hole that the SPC goes in. And I said, well, what are you going to do about that? We'll spray it possibly with, oh no, we'll put some saline lotion and some Aquacel on, which will fill the hole, and put the new dressing on, and we'll see what happens. But quite often when I've gone to the hospital to have it changed, they say, well, this hasn't been cleaned properly because there's too much pus around the tube where it comes out of the body. Because there's a yellow emission, which I don't know whether that's a sign of an infection or whether it's just a quirk of my particular case. Or, I don't know. Obviously everybody is different and react slightly differently to even the same catheter.
Do they clean around it every day?
Well, they used not to, but more recently I think the hospital wrote to them here and said it must be changed every day.
Cleaned every day?
Yeah, the dressing taken off, taken off, and the around the tube cleaned.
When I was first suggested that I should have a catheter, I thought they were condemning me to death. I couldn't imagine how I would manage any sort of a life. So you need to sell a catheter with the thought that it might be a benefit to you, that this might really help to change your life for the better. I didn't really get that. But then the first consultant that I saw wasn't a chap who would make you feel better.
Did the second one make you feel better?
Yes,
Yeah.
totally kind and confident, yep. I felt pretty depressed immediately after, because I felt I was tied to this bag and I would never be able to go out again or do anything again. And the district nurse took me, shook me by the shoulders, patted me on the head and said, "No, you're going to be fine." So then I felt better.
I believe it's something like 37 years since the Foley catheter was invented. The first thing is, I think that every patient should be shown before the catheter is inserted in them what actually happens. Because you're told there's a balloon. You're not told whether this is a balloon on the end of a sort of string that floats around inside your bladder like a party balloon or what. It's not explained that it's like a life belt tightly round the catheter itself and how it's inflated. All of these things, because it's inside you and you don't see it, I dare say most people haven't seen a catheter with the balloon blown up. I think you ought to be shown so you know how it stays in, why it stays in, how much of the tip of the catheter is there, if you pull on it, what you're pulling against, and similarly that the tip of the catheter, if that's rubbing against your bladder wall consistently, the irritation that that's going to cause. All of that, I think, should be explained in the early stages when you're first fitted with it, or in a brochure that you're discharged with.
Do you want to talk a little bit more about looking after it?
Yeah. I found that people don't always explain to you what you need to do. So I found that, whereas for some time I'd washed the bags out so that they didn't smell or leave any trace of urine, that actually you're not supposed to do that because of the risk of infection. And I didn't realise as well that when you put the night bag on, you're not supposed to take the day bag off, you're just supposed to attach the night bag. And it was only last year that someone actually explained that to me. And that wasn't in the hospital. I did find that the actual support side on catheters was quite limited. And as well, not everybody explains that you can bath and shower exactly the same when you've got a catheter in. And in fact, I found having a bath to be such a relief, because it's the only time you don't necessarily feel the pull of that bag or the tube in there. Having a bath, the bag just floats on the top, and
so you
it's quite
had the bath
comfortable.
with.
I would say that the information you are given is, to say the least, sparse. I think that if you were told recommended amounts to drink, the timing of that, timing of drinking through the day, and what liquids are better and why, I think that the health service could help itself quite a lot by giving people this information, and also pointing out giving people the incentive to help themselves by pointing out the effects of overuse of antibiotics, and the greater probability of infections if one doesn't do this, and the discomfort that the patient will endure.
Can you go into a bit more detail what it was like actually having to have a new catheter, having it replaced? Did they do that at home?
No, that was done at the surgery.
Okay.
It was something that I just hated. The catheter lasted about 2 to 3 months maximum. It should be, but unfortunately I used to try to leave it in as long as possible. But the drawback there is, of course, you can get an infection, which unfortunately I did a couple of times.
So before we go into what it was like when you had an infection, was it painful having a new catheter inserted?
Yes, very much so. Unless you had somebody who was good at it. But unfortunately, some of the medical people aren't.
The right way to put my catheter in, this is only for me, might be different for other people, is to put the catheter right in up to that B, and then over a day or so it gently slides out, and that's perfect. And I've had 3 instances in the last 15-20 years when the nurse has put the catheter in, and I've said to them, because I'm very, very adamant of because it works for me, and I know the consequences. And I say, this only happened beginning of November with one nurse. I said, look, that catheter's not in right. She goes, don't tell me what to do. This is it. This is what she said. Don't tell me what to do. I don't like putting catheters in, but I know what I'm doing. I said, you don't know what you're doing. Make notes on your diary, because that catheter isn't in for me. And she left it out 8 inches. And I said, that's going to give me a problem. She goes, look, I know what I'm doing. End of matter. And I was really cheesed off, as you can imagine. I wasn't very well. So that was bleeding in the night. So what she'd obviously done, I don't know how much you know, but my urethra's quite long by now, so she'd blown the balloon up in the urethra, and that was where the blood was coming from. None in the urine, so she damaged my urethra. No blood traces at all in the urine, so you could tell. And then I was really ill, probably one of the illest I've ever been.
Have you got any messages for health professionals?
Yes, try to standardize the procedure for the replacement and the understanding of catheters, particularly the suprapubic catheters. Try to have a standard procedure that people can follow, so it's written instructions which they can look at and learn, so that they all do it more or less the same way, the way it should be done. Because so many doctors differ in their understanding, and even nurses, by inserting catheters and the way to take them out, the way to put them in again, the way to realize that they've gone in sufficiently without keep trying to push them and abrasing the membranes of the bladder, which incurs, which makes bleeding begin.
And you've had particularly difficult experiences with GPs. You've got, I mean, do you think
Yes.
GPs should have extra training? Or?
Well, I certainly do, yes, certainly do. A lot of extra training. If they want to do that procedure, some of them shy away from it. They're not confident enough to do it. They shove it out. They shove it out to the nurses. And the nurses are reluctant to do it.
When I first left the hospital, I was living in a small village in Dorset, and the district nurse team, 3 or 4 of them, it was very small, and quite often it would probably just be 2 of them that came. So that was easier. Moving here into a bigger town, I found certainly a bigger team, more changes of faces, but actually I don't, they're quite good. I tend to see the same few people within the team, and I know the, what's she called? Community liaison nurse at the spinal unit. She came and did a bit of a teach-in on my catheter change because it can be a bit challenging. So I think we had about 11 community nurses appear and see how to change it. So there's plenty of them out there, but I tend to see the same few, which I think is better in the respect that they get a bit more practice, and it does seem to be less problematic if I've got somebody that's changed it a few times before. So that's good.
Again, speaking as a male, with a urethral catheter you can have sex, but the way they describe to do it sounds very sore, and is sore to do that, because you have to tape it back, which is pulling on a lot on it. When you have a suprapubic there, it's nothing in the way of you having sex easily, so it's an easy thing to do as you would normally. So that's the biggest advantage of having suprapubic over urethral. It's that simple, really. It's not something in the way of having sex if people choose to.
Then I decided, yes, that I would go for it. I'd have a suprapubic catheter. And I assumed, because nobody actually talked to me about the siting of the catheter, I assumed they hadn't discussed it with me because there was only one place it could go. I really had very little knowledge then about catheters and your bladder and where they can be placed. And
where did you think it was going to go?
Well, I just thought it had to go wherever they put it. And I thought the doctors were best placed to decide where it could go, and there was only one place, so they'd put it wherever the one place was. So I thought I didn't need that. I couldn't have a conversation with them, and especially since nobody brought it up, not my consultant and not the continence nurse. And although she was very good, and I'd had quite a few discussions with her about my body image, weirdly enough, this whole sighting of it never came up. So I went for the operation, which was done under sedation. Very simple for me anyway. I just fell asleep and woke up and it was all done, and very neatly. But when I woke up and I looked at where it was put, I was really alarmed because it was very low down on my kind of pubic bone, really near my vagina and really near my clitoris. And I thought, oh my God. And I didn't say this to anyone, not my husband, nobody. But I thought, oh my God, am I going to be able to have sex again? Will it get in the way? And then I thought, am I even going to be able to have an orgasm again? Because I had like this plastic tube right near a very sensitive place. But I didn't say anything about this.
Obviously, I didn't talk about this, but obviously when you were having sex, every time after I used to have sex, every time I emptied my bladder, my urine would be red, where obviously the banging of movement used to move the balloon inside your bladder, which used to irritate it, so then it would bleed constantly.
Did you ever ask the doctor about that, about the bleeding?
Yeah, he used to just say it was the movement. He used to say it was the movement, and there's not a lot you can do.
We had sex when we were away on a holiday, and I could have sex. We did have sex. I could still have an orgasm. That was fantastic. That was good. One thing that did happen was the first time and quite a few subsequent times, each time I would have sex, I would bleed into my catheter bag. So the first time that happened, I completely freaked out. We were abroad. I thought, oh my God, what if something serious has happened? Luckily, my husband, very calm, he said, look, just drink lots of water and let's see what it's like in the morning. And it was fine. It was absolutely fine. And I have, in the intervening years, asked my consultant, my urologist, my continence nurse, and several other health professionals in that area why I bleed sometimes when I have penetrative sex and what I can do about it. And every single one up to 2 years ago, so that was 6 years of people saying, I've no idea, I've never heard of that happening with anybody else. And I can guarantee I will not be the only one that this has happened to. But I think the problem is nobody ever discusses sex with their health professionals. So people could have been women having this problem, but just not wanted to talk about it with anybody. After 6 years, I asked a young urologist about this problem with the bleeding. And she said to me, because I wear a valve, I use a flip flow valve with my catheter, which I open and close at various times. It's mostly open, but I do close it for at least 10 minutes twice a day, because it's better for your bladder health. Anyway, she said to me, try closing your valve just before, like 5 minutes before you're going to have sex. And that might help, because what might be happening is, because your valve is open, your bladder is pretty empty, so that when you have sex, the end of the catheter might be kind of irritating and rubbing on in your bladder, so that might cause the bleeding. She didn't know 100%, but she said, try it. So I did try it, and that has helped. I don't never get it, but I get it very rarely now. And also I have to say that the bleeding didn't hurt, it didn't interfere with my enjoyment of sex at all. It basically, after 10 minutes or so, it stops, and then the urine is completely clear.
I then went on to local authority care. So there was no continuity of care. Standard is very low in terms of hygiene, and within 6 weeks I started to get blockages. First time it happened, I had no idea what had happened. I just knew I needed a nurse very quickly because it hurt, headaches and so on. I would then I just got worse and worse and worse, so that I was having catheters changed every week, every 10 days, and it got so that the situation became untenable.
2010, yes, I started getting UTIs, urinary tract infections, mainly due at catheter change time. But in 2011, I had a series of UTIs, which took probably 3 months to sort out, and included a hospitalisation because of a reaction to one of the drugs which I was given. Anyway, subsequent to that, after the end of that, I actually went to see a consultant urologist to talk about indwelling catheters, suprapubic catheters, and actually was given some information which sort of indicated that it's a problem, right? I was actually given some things to read which indicated it was a indwelling catheter. These suprapubic catheters were technology which hadn't changed in 50-60 years, would have an impact on my life expectancy, especially regarding urinary tract infections, and also renal failure in general because of backflow to the kidneys.
In the ideal world, a new catheter, a new design, what would you like it to do?
I think it has to be very much more discreet. It would be nice if the urine was stored inside the body, rather like an ordinary healthy bladder would work, expanding and then emptying, rather than having something that's external that attaches to you to store urine in. That for me, is a very crude solution. So really, I guess mimicking the sort of ordinary healthy human body in the way the bladder fills and empties. If something could be more inside the body and not so noticeable, that would be a huge positive. If I could manage it myself as well, that would be a huge positive. And if we can do away with all these things that continually cause problems, like the blockages and the infections, if there was a way of getting rid of all of those complications, and not having to take so many antibiotics, and not having to go to the toilet and apologise to a PA who's emptying your leg bag saying, "I'm so sorry, it smells so bad, but I've got an infection." And it's just all those, it's all those things that make you feel very self-conscious. The fact that somebody might notice this tube going under your trousers and this leg bag that's full and bulging underneath by the bottom of your leg.
I really would much rather not have to take any medication. I mean, when you say this, is there anything that you would like? It's like watching the horizon and seeing the sunrise, the thought that I could actually just not have to think about my bladder ever again, not have to have an indwelling catheter, not have to be on antibiotics, but deal with it in a completely reliable way. It would be absolutely like a new dawn to me. It really would.